as we are want to do, we do that with a moment of silence to remember just the hard times that we're living through with COVID and Black Lives Matter and political upheaval and all of that stuff. So let's just take a moment of silence to open our hearts and just wish good things for ourselves and the world. Great, thank you. And as always, just really, I'm so grateful for all of the work that you do. As I reviewed the many slides that we're going to go through today, it was overwhelming for me, and all I had to do is read them. We're expecting you all to implement them. So again, I really tip my hat to you for all that you do day in and day out on behalf of the folks that we serve. So welcome. And the agenda is the one that we typically go through on this deep dive with our partners. We take turns. Sometimes we have a topic that we want to explore, and then alternatively, we do updates from our different partners, and we sort of dig into the policies. So without further ado, we'll present to you the announcements. Again, a reminder that anything that's underlined, or in this case is in green, is a live link. So click on those and sort of look at them more closely. There are 7 critical guidance and best practices that are listed here. They're also listed in that link, and it's just good information. I believe this one is a 1 or 2 pager that you can print, hand out to folks. There's some information that's specifically designed for the consumers, and so we would encourage that you do make those resources available directly to the folks that we serve. So again, critical guidance and best practices for how to stay safe even as our numbers are continuing to climb. The next slide is on the CDC guidance for reducing. Again, click on it. Basically, I think we should just all assume that Thanksgiving and Christmas is canceled this year, along with any other holidays. Some of us will use this as an opportunity to decline the invitation to our family dinners. So take advantage of that, because next year we probably won't be able to do that. But it's just some really basic good tips on sort of, don't go to the family dinner with 50 relatives from 49 different states. So click on that and also review that with your clients or consumers. There's an updated CDC guidance on close contact, and you'll see that it's simplified here. But Lauren, do you want to sort of point this out more thoroughly?
Yeah, sure. So this is a pretty significant change. It happened just this week, so we wanted to make sure that people were aware of it. So the CDC changed the definition of what constitutes a close contact. So they used to say that being within 6 feet of an infected person for 15 continuous minutes, that was a close contact. And now what they're saying is that it's 15 minutes cumulatively across the course of a 24-hour period. So that we wanted to remind people about back in July, and I think Liz is gonna put into the chat box those slides so that if you wanna refresh your memory, we had gone through some HUD and some OSHA guidance on different scenarios, risk scenarios from highest to lowest, and who needs to wear what kind of protective equipment, whether it's okay for people to just use a cloth mask or whether they really should have medical grade PPE. And this change in the definition of close contact has implications for that. So just encouraging folks to go back and look at that and really think through this new lens about risk here of when you're in close contact, about who on your teams and in your facilities really should be wearing maybe a different kind of protective equipment. So that's it, John.
Super. Next slide is also some updated guidance around discontinuing isolation. Again, as science improves, we get different guidance, but the bottom line is we just need to make sure that we protect ourselves and those folks that we serve by continuing to quarantine when necessary, and always wearing a mask and washing our hands to reduce contact. So again, read these details at your leisure. The test-based strategy is no longer recommended, you'll see a link at the bottom of this slide for supporting homeless individuals exiting isolation or quarantine. You're probably getting this from a lot of different sources, including the internet, so I don't want to spend too much time on that, but again, there are links. This next slide, slide number 10, what to expect from remote case management. This is a handout specifically designed for consumers, and it's very easy. There's 3 points about using technology, privacy, and how to communicate with your case manager. And again, I believe it's a one-pager. I would encourage people to either print it out or screenshot it or send it to their consumers via internet, so that clients and consumers sort of can anticipate what it means to receive case management remotely. Next slide, the IRS has extended the EIP, and that's for folks who haven't received it and don't normally file a tax return. Extensions continue to have ended on the 15th. So again, there are links, and there are folks out in the community with a volunteer income tax assistance program that can also help people navigate through getting as much money back from the feds as possible. I mean, we love the feds, right, Alana? But they're as anxious to get us money back as we are. So again, you've seen a lot of that before. So eviction prevention information, there was a great webinar presentation on the 20th, just 3 days ago. It was recorded. There are slides from the presentation. And then this FAQ on moratoriums, again, it's a one-pager, and it basically condenses onto one page all of what was presented in the slides. So it's not automatic. So folks do need to walk through a few steps, and we are relying on the case managers to help them walk through those steps, complete the paperwork, and make sure that they're protected. And there are, in the FAQ and in the presentation, there are some caveats for when evictions can happen, and we all need to be aware of that. We know that there's some misinformation out there that basically says, hey, I don't ever have to pay my rent and I'm never going to be evicted. We know that's not true, and so we've got to sort of fight against that information as well, so that folks are not at the end of this time in this moratorium being wholesalely evicted because they were given the wrong information. Statewide legal services, again, they're sort of open and pleading with us to use them. They're the experts in the legal area, and if you even sort of hear hints of somebody receiving eviction papers or a landlord is threatening or anything, please, 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 they want us to call them and to use them. They're one of our strong partners, and we don't always think about them, but they're at the ready to work with our clients to keep them from being evicted. Okay, so that's sort of an update of So the announcements, is there anything else people want to add before we go to the DOH update? I know we're throwing a lot of information at you and you're going to get even more today. Remember that this is a resource. It's like the library. When you go there, we don't expect that you're going to remember and memorize every book in an encyclopedia. We want you to come back and reference it when you need it. And you'll see at one of the last slides where you can get all of this information. So without further ado, Steve DeLella.
Thanks, John. With DOH's updates, I think where we are right now is really working on trying to get out all that HUD dollars. We're so appreciative of the $20 million that we've got for the CARES Act funding. But in an effort not to overwhelm my fiscal staff and kind of throw every single thing that we're doing out there, we're kind of taking a chunk approach of this. So right now, our focus has been on the homeless eviction prevention program. So we're in the process of developing that. I know that our workbooks for those entities that will get funded went out today or are going out today. So we can kind of get that process started. And once we have that out there, I'll start on the next batch, which will include homeless diversion, some of our COC new grants, as well as some CAN funding from the CARES Act. What I know is of biggest importance right now, too, is some of the cold weather protocols and how we are going to ensure funding for that. We've received all of the budgets from the CAN, so we're appreciative of that, and now we're just reviewing them. We understand that a lot of those requests are going to change as plans for cold weather change, going from one facility to the next, or maybe to hotels. So we're certainly will be flexible. So I'm just working with the commissioner to kind of get to the point where we can at least send out award letters and then contracts to follow, because like I said, we're putting out so much money right now. It will take some time, but hopefully with those award letters, that will be good enough for the CANs to kind of start their process to start standing up the facilities that they're going to need once the cold weather hits. So hopefully by the end of the year, we will have all of that funding out. We'll just let it turn over to the providers to do all the great work that you do.
Great. Thanks, Steve. More money, more money, more money. That's what we like to hear. So Alice, what kind of money you got for us from Demas? Are you looking under your desk for the cash?
Wait 1 moment. And the trees, all the trees have the leaves and the money have fallen off in the backyard. Sorry, everyone. But we do have 2 exciting new things. One, to the slide earlier, we are doing a telecase management training on Monday. I think Mo put the link in the chat box. Thanks, Mo. And so that's really to help providers address as we've moved into doing the telecase management, and as the winter is coming and we may have to scale back how much indoor activity we're doing given some increasing positivity rates, especially here in Connecticut, although we're still very low. We really want to make sure that people are safe. So if you haven't already, or your staff hasn't already, to sign up for that, that's very exciting. Kyle Barrett and I will be doing that training. So, if you want to listen to us for 2 hours on Monday morning, sign up. And the other non-monetary gift we have for you is that we are continuing the waivers through the end of 2020. So we have sent that out. I just want to remind folks that the waivers really are that you don't have to have paper and pen signatures. We're taking electronic signatures. We're waiving all of that piece of it, but we still expect and require that people do the documentation, do meet with folks, do work with them on the assessment and acuity, work with them on a service plan. We understand that you might not be able to have folks sign anything with a pen, but we're asking that you do electronic signatures or somehow have the person acknowledge that they've approve the plan, etc. So it's a waiver for the signature piece, but not the actual work piece, unfortunately. And so those are my two announcements. If anybody has any questions, you can put them in the chat for me, and or just email me outside of this. Sylvia now who has a mask on. So that is all I have for today. And John, take it away.
Great. Hey, for folks who may have missed a meeting or two, just want to reintroduce our fourth co-chair, Monique Price-Taylor. Monique, can you unvideo yourself and do a big wave out to everyone? We're thrilled to have Monique with us. She works for the Corporation for Supportive Housing, has been very active and strong partner with us, and now she officially sits at the table with the other co-chairs. So just want to do, I think this is going to be the last shout out to Monique, because at some point it gets old reintroducing you as the new co-chair, but some folks may not have caught that in previous meetings. So welcome, Monique. And so without further ado, we're thrilled to have our partners from DSS joining us this morning, and Kristen Dowdy will walk us through some of her slides. And again, just a reminder, it's more information that you're going to be able to digest in the short period of time that we've given to her, but they will be at your disposal after our meeting. Kristen, good morning.
Good morning, and thank you everyone for having me join you. It's been a few months, so it's exciting to be here and tell you a little bit more about what we're doing at DSS. I am covering some items that we covered at the last time I joined you, so I'll probably just gloss over those, but you can feel free to either ask me questions through chat, or I have provided my direct email. You can follow up with me separately. One of the most important things, that I'm sure that most of you are well aware of, is that Secretary Azar of the Department of Health and Human Services has extended the public health emergency period. He announced that on October 2nd, and it goes into effect today. So I believe we're in the third up to 90-day extension period. We expect that will go through late January of 2021. So what that means for us is that we'll be able to continue covering anybody who is enrolled in the Husky Health program as of March 18th or after. We've been able to, and I've listed those separately, I won't go through them all, but we've been able to extend people who were up for renewal, individuals who might have been reporting changes that would otherwise make them ineligible for continued coverage. We're able to keep them on and keep everybody enrolled. So we're doing that. There are a few exceptions to that rule. Voluntary disenrollment, relocation outside of Connecticut, an ineligible immigration status, aging out of our Husky B, which is our CHIP program. It's not Medicaid, the Children's Health Insurance Program, and certainly death of an individual would end benefits. Other than that, we're enrolling everyone. Again, these are all of the ways that we're allowed to make that happen by ignoring or delaying acting on certain changes. For example, one thing I did want to point out on the next slide actually is that we are recommending that when you receive a communication from us or the individuals that you're working with receive communication from us that it's time to do a renewal, to ask them to please follow up to the extent that they can. Certainly, if they're unable to complete their renewal or they don't have enough information to report a change, they don't need to act on that. We're going to continue their coverage either way. But if they do have new information to share with us, it's always better if they do try to complete those processes. We would love to be able to give people another year of coverage rather than just giving a few months at a time. And then operationally, of course, that prevents everybody that we've been extending, which is about 8,000 individuals a month, from coming due at the same time. So at some point, whether it's January or if there's another extension, we'll see, we will need to take measures to start disenrolling and terminating individuals. So that's all I'll say about that. The rest of the stuff I did cover the last time, so feel free to reference the material and follow up with any questions. Again, some of our waiver flexibilities that I mentioned last time. We can move on. Also, I did mention this last time as well, but want to reintroduce the fact that we did implement a new Medicaid coverage group. There is a new program for individuals who don't otherwise qualify for the Husky Health program. It provides only limited benefit coverage for COVID-related testing. So the instructions here about how individuals can apply can be shared with others. We encourage individuals to go to a shared electronic application that we have with the Health Insurance Exchange, Access Health CT. They can go online, apply over the phone. The individual may receive a denial that they don't qualify for regular Medicaid or CHIP, also known as the Husky program. But not to worry, individuals who are denied because they don't otherwise qualify will receive a separate communication and will enroll them in the limited benefit COVID-19 coverage. We'll do that automatically, and I've also included a copy of what the card looks like. They will receive a card for that program.
Next slides.
In general, for your reference, I've included information about how to apply for Husky and other programs. You'll see there's the web link also for the Connect portal for SNAP and other programs. Certainly individuals can apply for benefits in person at DSS, but there are only limited services available at this time. And I've included that in a following slide as well. Really quickly for SNAP updates, 6 month extensions for those cases that weren't previously extended. So with people coming due in November and December, we're waiving requirements for the PERF document. We're also waiving requirements for interviews right now for recertifications and postponing applications for expedited cases. We will continue issuing SNAP emergency allotments for as long as we're allowed, and these are for households not receiving the maximum benefit currently. And we've done this since April, and we'll be doing it again through November. And that's it. There's just some reference material, some information about our office hours. Just this week, we decided for the time being to close our offices on Wednesday to allow our staff more time to process applications and renewals for individuals. So both our field offices and our telephone benefit center will be closed on Wednesdays. The call volume has been pretty high, so we thank you all for your patience, but we're hoping that this measure will help with that. The more current we are, the more caught up with the increased volume of applications for assistance during this time should reduce the need for individuals feeling like they need to call. So that's what's going on with that.
Great. Thanks, Kristen. Appreciate you being with us. All that good information.
You're welcome.
So I say this every time I introduce Atlanta Cable. We are so grateful and so blessed to have a field office who is a partner with us. And so Atlanta, I'm gonna mute myself and let you take it from here.
Thank you, John. Good morning, everyone. It's great to see you all and be with you today. As Steve alluded to, we are pushing a lot of funding out the door. We have actually 2 different bodies of funding applications that are coming in. One is 5-year con plans with a 1-year action plan, and that's how our 23 entitlement communities apply for their regular, CDBG, ESG funding, and the like. So we've gotten 18 out of 23. We have 23 entitlements in Connecticut. 18 out of 23 have been submitted to our office. With regard to the CARES Act amendments, the first tranche that we issued, we've received 17 of 23 amendments requesting those funds for those particular communities. We are in contact with those that we have not received amendments from yet, trying to get a handle on their time frame. There isn't there isn't really any deadline at this point other than they have to spend 80% of the funds within the first 3 years, and that's 3 years from the date I signed the funding agreement. But obviously, this is a pandemic that we'd like to see everyone use our funding to respond to as quickly as possible. So we are in touch with the others. We're offering technical assistance where we can, and really encouraging them to get those amendments in as expeditiously as possible. The state of Connecticut, and thank you, Steve, they've submitted for tranche 2, which was a tranche that went out to states only. And as you all know, we've announced tranche 3. We do have one plan in, and that's from one amendment in, and that's from the City of New London. We are at this point able to complete our reviews. We don't have grant agreements for it yet, but I expect those shortly. So, you know, keep in mind, 22 out of the 23 entitlements haven't submitted the plans yet. The Reaching Home Sustainability Work Group did reach out to all 23 entitlement communities with public comment on the funds, asking that they be used for affordable housing and the like. So I'd encourage any of you who have contacts with your local communities to certainly reach out to them, see when their public comment periods might be, because we certainly want to make sure that as many people as possible are at the table when local decisions are being made about how to use these all-important funds. We did give all of our 23 grantees an extension on submitting their annual performance evaluation reports. They typically submit them 90 days after their program year ends. We've given them up to 180 days to submit it. We can even go beyond that if there's a need to, and they can document that. But they have started to trickle in. So just keep in mind, you know, we're spending time trying to get funding out the door, but tranche 3, we have not yet received 22 out of 23 applications, so, or amendments. So there may be opportunities there. On the continuum of care side, my staff is very busy processing annual performance reviews, getting letters out the door, closing out grants where we can, and that's all in preparation for our risk analysis, which we will kick off next month. As you know, every year we risk analyze all of our competitive and our formula grants. So they're trying to get the APRs done so that that information can help inform risk analysis for our COC grantees. A couple of trainings and announcements that have come out recently through the HUD Exchange. There is an IDIS setup and draws for ESG CV funds. There's a session on that on October 27th at 3 o'clock. We do have office hours this afternoon. There's also an addressing unsheltered homeless as the colder weather hits. That just got announced this morning. That's going to be held on October 29th at 2:30 p.m. Again, office hours today at 2:30. And we sent out on the 22nd a new COVID-19 resource digest, which lists for you a number of tools that you can use to help you implement your programs with CV funds from HUD. Unfortunately, I know it's the burning question. I don't have any news on the competition to share with anyone at this point. You're probably all going to hear before I am, but I don't have anything to share yet. So that's about it for us, John.
Great, thanks, Elena.
Yes.
Hi, it's Alice.
Hi, Alice.
I know we don't have any information regarding the NOFA. Just wondering if there was any guidance regarding the pit.
The what, please? I'm sorry.
Sorry, the pit. The pit?
Oh, I have not heard anything on the pit. I can inquire about that, though, Alice. I have not heard anything on that. I'll ask for an update from headquarters.
I mean, we're moving ahead as we normally would. I just didn't know if there was any additional guidance this year.
Yep, I'll find out.
Thanks.
You're welcome.
Great. So Alana, if you will mute yourself.
I will do that. Right.
Excellent, thanks. Just a reminder for folks who are fairly new to the COC machinery. Alana referenced the risk management or risk analysis. That's where they determine who they're going to come out and review. And if there are findings that have recapturable risk, they're required to take money away. We do a really good job of making sure that that never happens because we've hired Housing Innovations as our consultants to do the monitoring. So when they come to you and they say, okay, it's your turn to be monitored, your response, your proper response is to say, oh, yippee, this is great, because once I get through that monitoring, I can rest assured that if Alana or her staff call me and say, now we're doing it for real, that I have nothing to worry about. So I just want to make sure that we sort of put those two dots together. I know Alana is crushed that she never finds any recapturable risk in Connecticut. But in all seriousness, that's why we do such a strident job of monitoring our providers, is because it's better to hear it from a friend than to hear it from the actual funder. So without further ado, I'm going to toss it over to David Gonzalez-Rice from CCEH. Hey, David.
Good morning, everyone. Let me piggyback quickly on Alana's comments about partnering with your local PHAs. I'll share that we've been in touch with contacts in some of the CANs who have an open line of communication with their PHA with respect to the Housing Choice Voucher mainstream opportunity that's out now on a rolling basis. So I'll say briefly, CANs and homelessness providers could position themselves as a referral source for housing authorities that update their waitlist preference and make modifications to their admin plan to do so, and that can be worth their while because it can help them manage their waitlist process and ensure that they've got the utilization rate they need. So if that's something you're interested in hearing more about, you feel free to reach out to me. I'm getting quickly educated about it, and I know some of my colleagues at CSH have been having similar conversations with a lot of communities. I just dropped a link in the chat box here. There's a lot of information there, all the different deadlines and technical information that you and your staff might need to navigate your clients through registering to vote, requesting an absentee ballot, dropping that ballot off, getting to the polls, registering day of, etc. A couple of things to note there that are especially relevant for you all and that were news to us this week at CCEH. One is the recommendation that for same-day voter registration, it's a good option for clients with no ID currently on them. That option is not available at the polling place, but each community has a designated election day registration location with hours between 6 a.m. and 8 p.m. And the registrar advised us at a good time to go and exercise that option would be between 11 in the morning and 3 in the afternoon when it's least busy. One other thing to note, the window to request an absentee ballot is closing, and any agencies that are collecting and distributing applications for absentee ballots, please be aware, if you're distributing any more than 5 such applications, you should register with the town clerk where your facility is located. And there's more information about that at the link as well. So to make sure that we're staying on this side of the law and ethics, just want to encourage you all to do that. We want to be as assertive about helping people we serve get to the polls as we are careful about following all of the rules. Last couple of things. We have a motivational interviewing training that CCH is offering next week, a handful of slots there left. It's a 2-day training on October 29th and 30th. And your staff can get continuing education credits for that. We do charge a fee for that training, but I mention it here because it's a particular opportunity for professional development and continued education. And then we were really pleased at our annual Training Institute to announce that we were launching a fund for costs related to pets, where needs for pets are a barrier to housing. Our training team hosted a webinar on this project in collaboration with PetSmart and other new partners just last week. You can find information about that in our newsletter of this morning or on our website under the webinars. The recording is there, the slides are there. It is more or less folded right into any emergency assistance already administered by CCEH, so diversion funds, rapid exit funds. There are agencies in each CAN that have MOUs signed to access those funds. So those would still be the points of contact for clients you have who are eligible. Those would include people experiencing literal homelessness, unsheltered or in shelter, people who are presenting at the CAN for diversion, as well as clients currently in a housing project who are at risk of losing their housing, where that referral is coming from the CAN housing solutions or matching meeting case conferencing process. So again, the path from you or your staff to the CCH request will go through whichever agency locally holds that MOU and has access to the portal for our requests. That's typically a CAN backbone agency, but not always. So that's all I've got for you this morning. Please feel free to email me if you have any follow-up questions.
Great. Yes, so any questions, drop them in the chat box if you're able to. And before we sort of go into the next 20 minutes, I just want to invite everyone to take a minute and take a deep breath. We went through a lot of slides, heard from a lot of our partners, and Lauren is going to walk us through some of the densest stuff you're going to ever be subjected to. That's probably not a good word. Be invited to learn about, maybe, but just buckle your seat belts, take a deep breath, and Lauren's going to try to make it as painless as possible. But we know that this next and last section of our agenda is really sort of dense. So with that, take it away, Lauren.
Hey guys, so I will try to go through this quickly so that you don't all fall asleep. But HUD did issue a new third round of waivers, COVID-related waivers for the COC and ESG programs. And we at CT BOS pulled together a whole bunch of detail and guidance for you that describes all of the waivers that are currently available, including but not limited to this latest third round, and the links both to the original HUD memo and to the CT BOS guidance that we compiled is on this slide. Our friends over at DOH, in their ongoing effort to try and make things as simple as possible for everyone and keep all of the requirements for the different funding streams aligned, has also, where they had federal authority to do it, aligned the DOH ESG requirements with the new waivers. And I'm not going to go into all that detail today, but those details are in the memo. So what I am going to do now is quickly go through what are the new waivers that are available to you, where existing waivers have been extended by HUD, and finally, what the requirements are for notification if you would like to use any of these waivers. So the first new waiver that HUD has made available is that you can now use participant self-certification of income when you're calculating rent without having to document your attempts to gather third-party verification, and that third-party verification was unobtainable. Now, obviously, getting third-party documentation of income is preferable. So if you can get third-party documentation of income, you should. But by all means, if that's difficult during COVID, if someone's employer has closed up shop, if the Social Security office has a 3-day backlog and isn't getting back to you, please move forward with self-certification so that we're not delaying anybody getting housed and or having their rent recalculated, particularly if their income goes down. So, and that waiver is effective through December 31st. So for all of these waivers, what HUD has been doing is as they expire, they've been extending them. And, I obviously can't predict the future, but if I peer into my HUD crystal ball, I don't think any of us anticipates that we are going to be out of COVID world by the end of this calendar year. And if we can rely on the past to predict the future, right? I think it's likely that all of these waivers will be extended again. The second new waiver that HUD issued is enabling you, rather than doing either a physical or a remote initial inspection of units for housing quality, they are now enabling you to use just an owner certification. So you can have the owner certify that there are no life-threatening conditions in the unit, and you can proceed to assist that unit with COC. And this is one of the places where DOH aligned their standards with DOH ESG funds. And so you are required, if you're going to do that, to update your emergency policies. And we have updated the sample emergency policies that we created for you through BOS to incorporate all of these new waivers, including this one. So, and then just again, as was the case with the previous waivers, right? We really obviously want to make sure that folks are living in safe and decent housing. And so wherever feasible, CT BOS, DMIS, DOH are really encouraging you to continue to do initial, probably at this point, remote inspections of HQS. And just a quick reminder, right? So the initial inspection, you can do the owner certification now in lieu of the inspection, right? And then for the annual re-inspection, HUD previously waived that requirement. So you are not required currently to do the annual re-inspection. But again, right, we want people to be in safe housing. So if you can, please do. The next brand new waiver that HUD issued is to help where you've got a household with more than one person, and maybe they can't find a unit that's big enough, or maybe they're worried that they're not going to be able to afford that unit once the assistance is no longer available. HUD has waived the suitable dwelling size requirement only for COC rapid rehousing. So this has not been waived for permanent supportive housing, only for COC rapid rehousing. And so the previous requirement has always been that you had to have at least one bedroom or other room where people could sleep for every 2 people in a household. And that requirement is now waived for leases that are executed between September 30th and December 31st of this year. Again, likely to be, we think, probably extended. So, and so what that means is basically if you sign a lease during that period, the waiver is in place until the end of that lease term, right? So, so that's an important thing to keep in mind. And then the other thing we just wanted to encourage folks here is that we know obviously that overcrowded housing is a risk factor for COVID, right? So the more folks you're, cramming into a unit, the higher their risks are for COVID. So you really want to balance that against the other risks that people face, right? The risk of maybe if they're in a crowded congregate, sheltering situation that, that's even more risky for them. And so you want to think about that as you use this, and maybe think about, for example, not using this waiver to house more than one household in a unit, right? Because the more households you combine, the higher everyone's risk go. And then whether or not it might be possible to help them to do some partitioning in order to make the unit both safer in terms of social distancing and also more comfortable in terms of privacy for everyone. And then finally, it's important to keep in mind that if there are local or state occupancy requirements, right, that this waiver does not exclude you from having to follow those requirements, right? Those laws still exist. You still need to follow them where they exist. So the other brand new waiver that HUD released recently is how long people can stay in institutions and retain their literal homeless status. So it used to be for a long time now that HUD said that if somebody went into like a hospital or jail and they stayed there for 90 days, up to 90 days, they retained their homeless status. As long as they were homeless before they went into that institution, they were still homeless when they got out. That has now been extended to 120 days, and this applies both for COC programs and for ESG programs. I think the confusing thing about this is that it only applies to literal homelessness. HUD has not extended this to the chronic homeless definition or the dedicated plus definition. So if you're qualifying people to be for PSH as either chronic or dedicated plus, the old 90-day rule still applies. Okay, so this is mostly for us in Connecticut BOS because all of our PSH is chronic or dedicated plus, right? This is mostly going to be for, for rapid rehousing and a little bit of transitional housing that we still have remaining in the portfolio. Okay, so that's it for the new waivers. And this next set of stuff I'm going to talk about really quickly are just waiver extensions. So when and if we hope that HUD ever drops the 2020 NOFA and we actually have a competition, they are going to assume that any amendments that you made, that you executed between March 31st and the end of the year, right, that those were intended to be temporary to help you respond to COVID. And so when you apply in the competition, you're going to have to apply at the budget that you had prior to that amendment. And don't worry, we will remind you about all of this stuff when the competition hopefully opens sometime soon. The next one they extended, HUD has said that for COC leasing projects, right, that normally those projects are required to lease units at or below FMR. And they are now, like the COC rental assistance projects have always been able to do, able to rent units up to the rent reasonableness standard. So, that waiver has been extended. HUD also extended the waiver for disability documentation for PSH. So, because of all the disruptions in the systems, it may be hard to get third-party verification of disability. And so HUD has said that you can accept client self-certification of disability, and that has now been extended up until local officials determine that such measures are no longer necessary. The important thing to keep in mind here is that PSH is a scarce resource, and that we want to make sure that our PSH is going to the people who are most needy. So please, please, please make sure you are only using this for people that you are sure actually meet the disability definition. And DEMIS is actually requiring that you can use the self-certification to initiate the assistance, but they are requiring that you eventually obtain the third-party evidence of that disability and have that in the file. And that, again, is to make sure that we're using our PSH for the folks who need it most. So a couple more extensions. So the waiver of the requirement to provide rapid rehousing case management at least monthly, that has been extended again whenever feasible. Obviously, it's super important for people to be getting case management, so please continue to provide that case management remotely if you need to, as much as is feasible. And the HUD clarified that in the last notice, there was this kind of confusing language that said the usual COC requirement is that leases have to be for at least a 12-month term. And in the last round of waiver notifications, HUD said that they could be for any period longer than a 1-month term, which is confusing because leases normally aren't for 2 months. They're either, sometimes month to month. And so they've since clarified that what they meant is that leases can have to be at least 1 month, and that was also extended. They've also clarified that you do need to notify the field office, both of your intent to use any of the new waivers, as well as, even if you already notified them previously that you are going to use one of these waivers that has now expired, you have to notify them again of your intent to use the extension. And I'm going to go through that in a little bit more detail in 1 minute. But before I do that, quick reminder, again, these are not the ones that I just talked about are not the only ones that are available. There's still other waivers that are still in place from the previous 2 rounds of this. In the interest of not completely overwhelming you all with a gazillion details and putting you all to sleep, we did not include all of those, but that information is in the memo. There's a table at the end of that memo that's like a really quick summary that goes through all of the waivers and what the extension dates are for all of them. So in terms of notification, you do need to notify both HUD and CT BOS if you're planning to use these waivers. The Hartford field office has created this handy dandy central email. It's the same email that you used before for the previous set of waivers, and they would like you to send this 3rd set of waiver notifications to this email. And just a reminder, this is a notification, not a request, right? So you don't have to wait for them to say, yes, you're approved to do this. You just have to notify them and have that notification on record. And so we are also, like we did before, asking for you to let us know if you're going to use those waivers. And CT BOS is moving away from using Gmail as the way that people submit information to us. As John said recently, we are moving into the 21st century, and we have developed this web-based database called Zengen. So in order to submit all kinds of information to CT BOS, including but not limited to these waiver notifications, you do need to make sure that all of your projects have created an account in Zengen and that you've got the ability to submit those documents. You want to make sure that if you haven't already done that, you do it really soon, because the renewal evaluation submission deadline is quick approaching. So please be sure you've done that. And we've linked to, we did 2 trainings. Shannon and Liz did 2 trainings in the past few weeks. And there are detailed instructions linked here on this slide. We also, to try and make this as easy for you guys as we can, we know it's very complicated, but we really are trying to make it easy for you. We've updated the waiver notification template to include all of the new waivers that were just added. So please, if you're going to be doing a notification, make sure you access that newest template, because that's where the latest information is. So just a quick reminder, this should be a refresher for folks about who needs to notify HUD and CT BOS that you're going to use these waivers. It's the recipient, not the subrecipient, right? So if you get your COC funds or your ESG funds through either DMIS or DOH, they have already notified HUD of their intent to use all these waivers. And if you're a subrecipient, you can just proceed to use them. If your agency gets funds directly from HUD, you are the recipient, you have got to notify them directly. And finally, if your agency gets either COC or ESG funds from a recipient other than DOH or DMIS, you've got to coordinate with them to see what they notified HUD that they're going to use. And you can only, if you are a subrecipient, use the waivers that your recipient has notified HUD about. All right. This is just, again, a reminder that for using all of these waivers, HUD has said repeatedly, you are required to have updated emergency policies. We have updated our sample policies. The link is here. They have also said that there's certain documentation requirements, things that they want you to keep in the participant files. We're not going to go through all those details, but those details are in the updated sample policies that are linked on this slide. And then finally, this is a table that just is a quick reference about who needs to do what in terms of notification of HUD, in terms of adopting a policy to authorize both waiver use and hazard pay. Because remember, you'll remember, you know, over the past several months, we've talked about HUD has said that you can use federal funds for hazard pay for your staff, but you do need to have a policy as an agency authorizing this. So, so this just is a quick reference about what the recipient needs to do versus what the subrecipient needs to do for all of these things. And I think that's it, John.
Okay, well, that's what happens when you draw the short straw. So thanks, Lauren. Next slide, just here's our next meetings. Next slide after that. So this meeting was earlier meeting that got bounced to this date. So our next COVID office hours are actually just 2 weeks from now, and confirming that that's on a Thursday, not a Friday, because another meeting is conflicting with it. So Thursday, November 5th, 9:30 to 10:30, folks are invited to bring pictures of their children or pets or spouses dressed in their Halloween costumes. You can use it as your screenshot, but let's sort of do a Halloween parade on November 5th, and then we go back to seriousness on our steering committee meeting, which is on November 20th, 11 to 12. Just a reminder that our COVID office hours next time in 2 weeks is a deep dive with Community Health Center, Inc. on vaccine hesitancy, and then also CCH will be talking about their COVID-19 testing data that's in HMIS. We are sensitive to the fact that in the United States, vaccines have a deep racial history attached to them, and so we need to be aware and sensitive to that as we promote any new vaccine that might become available to consumers who have that history in their background or in the back of their mind. So we're going to try to unpack that a little bit. And I think unless there are other comments from the team, we are ending right on time. So happy Halloween, everyone. The rest of the slides are the slides you always see, which is resources, 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 and how to get a hold of us. So until we see you in 2 weeks, be safe, eat as much candy as you possibly can, and TGIF. Thanks, everyone. Bye-bye.